Hey skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon. Today I'm coming at you live from negative 15 degree weather here in Jackson Hole, Wyoming, to give you 5 winter skincare tips. Before I get started, make sure to hit the little bell icon so you can get notifications anytime I post a new video, and make sure to hit the subscribe icon so you can stay tuned to my YouTube community. Okay, so the first thing that needs to discussion is, why do you have to actually change your skincare routine in the winter? Well, the reason is because cold air is less able to hang on to moisture. And so as a result of that, there's a lower humidity in the air, which means that our skin gets drier. The other part of it is that when we're indoors a lot more frequently because it's cold, we're more subject to the indoor heating systems, which can also make the air a little bit more drier. So it's super common for a lot of people to come in at this time of year with dry, flaky skin, lots of irritation, and we're always trying to change people's skincare routines to make sure that they can get through this winter period of time. So today I'm going to give you 5 winter skincare tips that you can take home with you and hopefully improve your winter skin. Okay, so winter skincare tip number 1 is to look at all of your active ingredients, and any of them that can cause irritation, like salicylic acid, benzoyl peroxide, glycolic acid, tretinoin, or any of the topical retinoids. You want to take a look at those and see how often you're using them, and see if you need to cut down or shift which ones you're using. So for example, if you're using a topical retinoid and you're using it every night, in the winter you might have to go down to using it every other night. In addition, if you're using a salicylic acid or benzoyl peroxide in your wash, you might need to use that less frequently, like maybe 1 or 2 times a week, so that your skin isn't getting too dried out. You have to play around with it a little bit and see what your exact skin type needs, but that's where I would start. You might even need to switch to just a gentle cleanser instead of a cleanser with lots of actives in it, so that your skin doesn't get too irritated. If you really want to keep the active ingredients, so for example, if you have acne and you really need to keep using those active ingredients like salicylic acid, benzoyl peroxide, one thing you can do is switch up the formulation, like the vehicle that it's being presented in. So for example, if you're using something that's more alcohol based, like a solution or a gel, you might want to switch to something like a cream or a lotion, because that's going to be a little bit more hydrating, less alcohol content, so less likely to dry you out. The other way that you could adjust your actives would be, instead of using something that's a leave-on where it sits on your skin, you could switch to using it in more of a cleanser, which is something that gets washed off, so there's less contact time on your skin, so that it could be less irritating, but you still get the ingredient. Skincare tip number 2, moisturize. So for moisturizing, you can look for moisturizers that contain glycerin or hyaluronic acid. Those help draw moisture into the skin. Really what your big time key player is going to be is an ointment. So in the world of moisturizers, there's lotions, creams, and ointments. Lotions have more alcohol content. They tend to evaporate more easily. They're less moisturizing, whereas ointments, on the other hand, are greasy, clear, and those are going to be the best at maintaining your skin barrier. So if you're getting real dry, you should go for the ointment. Go for an Aquaphor, go for a Vaseline. Those are going to help maintain your skin barrier the best and really help lock in the moisture. And the best time to do it is right when you get out of the shower, when the skin is damp. Lock it in. There's been studies that show that when you get out of a bath or a shower, and if you don't moisturize, that's when you lose the most moisture in your skin. So that's when you want to do it, and do it every day if you can. Okay, I had to take a break from being outside because it was way too cold and my fingers were about to fall off. Skincare tip number 3 for the winter is get a humidifier for your house. We know that the air in the house is more dry because of forced air heating systems. So get a humidifier, put it in your room. That can really help even with like your respiratory system, but it can help with your skin as well. Okay, my husband just kicked me out of the house. So skincare tip number 4 is you can take omega-3 fatty acids, and that can help with dry, itchy, flaky skin. I use omega-3 fatty acids for my Accutane patients because they're on high-dose vitamin A and they can get really dry skin, dry lips, and it does tend to help. So you can also try incorporating that either into your diet by incorporating more foods that have omega-3 fatty acids like fish, healthy fats, or you can take it in pills and supplements like fish oils, flaxseed oil, and that can really help with dry, flaky, itchy skin. Okay, and tip number 5, this is for more hardcore cold injury prevention. When you're in a place where you're outside a lot and it's freaking cold. So, tips to prevent cold injury. So what I'm talking about is when you're outside, maybe you're skiing for a long time, who knows what you're doing, but you're more susceptible to getting frost nip, which is like early cold injury, frostbite. You might get it on your nose, your fingers, particularly for people who have problems like Raynaud's, where their blood vessels are really hyperreactive and they constrict really easily when exposed to stimuli like cold. You have to be super careful to not get cold injury on your skin, because if you get it over and over and over again, it actually can cause more permanent damage in your blood vessels and in the tissue, which can lead to chronic symptoms like itching, burning, tingling. You might have heard of things like pernio or chilblains. That can happen when you are subject to cold temperatures that are not quite freezing, but maybe in damp, cold environments. So the tips that I have for these are: 1, try and maintain your core body temperature as warm as possible. Wear nice warm clothes. Make sure that you're wearing mittens for your fingers. That can be a little bit more effective than gloves. For some people, you should even get battery-powered heated socks, heated gloves, heated mitts. That can help as well. And in Jackson, sometimes what we're even doing is giving people topical nitroglycerin, which is a medicine that will help dilate your blood vessels so that they don't clamp down and get so constricted. Some people even get on oral pills like calcium channel blockers such as nifedipine, amlodipine, that will help dilate those blood vessels so you still get blood flow to your fingers. All of that can really help. If you're out skiing, you can get these special little covers that will cover your cheeks and your nose, so that way you don't get chronic cold injury and sun to your nose. So hopefully all this information is helpful for you. If you have any questions, just reach out to your dermatologist. They should be able to help you out with that. If you like this, please feel free to share with your friends, drop a comment. I'm always happy to answer questions, and stay warm out there, folks.